Hi, Miss Wilder, it's your nurse. May I come in?
Yes.
Thank you. Completing hand hygiene. All right, hi, Miss Wilder. My name is Olivia, and I'm going to be the nurse taking care of you today, okay?
Okay.
How are you doing?
I'm doing well.
Good. All right, Miss Wilder, do you mind confirming your first and last name and your date of birth for me?
Elizabeth Wilder, 10/31/05.
Great. I'm going to go ahead and just check your hospital bracelet. Thank you. All right, so Elizabeth, do you have any allergies?
No.
Okay. And Elizabeth, would you prefer if I called you Mrs. Wilder or Elizabeth?
Elizabeth is fine.
Okay, perfect, thank you. All right, Elizabeth, so today I'm gonna go ahead and just take a listen to your lung sounds and your heart. Would that be okay with you?
Yes.
Okay, great. So this assessment, I'm just gonna begin by asking you some questions, and then we'll move into the hands-on where I'm actually taking a listen, okay?
Okay.
Great. So for you or for your family, do you have any history of lung disease?
No.
And in the past couple weeks or days, have you had any cough or shortness of breath?
No.
Okay. And what about, do you smoke at all?
No.
Okay, great. And then, have you had your flu shot this year?
No, I haven't.
Okay. And then, what about COVID vaccine? Have you had any COVID vaccines?
Yes, I have.
How many did you have?
3.
Okay, great. All right, so that kind of concludes the questions I have about your respiratory system. So now I'm gonna go ahead and start looking at you, okay?
Okay.
So as I'm sitting here looking at my patient, she seems to be breathing. She's free of distress, and as she's breathing, she's not using any of her accessory muscles. The chest is expanding symmetrically. You can see it equally rise and fall on both sides. All right, and then I'm also inspecting her skin color and her lips and her fingernails. Her skin color is pale, but that makes sense for her ethnicity. Her lips are a nice healthy pink color. There's no cyanosis. And I'm looking at her fingernails, which are also pink, and there's no signs of cyanosis. All right, now I'm gonna go ahead and just have you sit up a little bit so I can look at your back. So I'm gonna just move your hair if that's okay. And now I'm gonna just palpate her posterior thorax to make sure that it's symmetric. The thorax back here is nice and symmetric. There's no bulging, no lumps. Is any of this tender?
No.
Okay, great. All right, I'm gonna lean you back, okay? And then now I'm gonna put your hair back, and if it's okay, I'm gonna palpate on the front side of your chest, okay? So I'm just gonna go ahead and move this blanket. Let me know if any of this is tender, okay? Okay. So I'm feeling her ribs, and right here, kind of where her ribs come together at the sternum, is her costal angle, and that is at 90 degrees. So I'm not concerned about any barrel chest. I'm also looking at the anterior, posterior to lateral chest wall ratio, and that is normal. So there's no barrel chest present. Okay. And then we also assessed the muscles for any tenderness and for symmetry. So now I'm gonna go ahead and complete a little test. So basically I'm going to have you lean forward again. I'm gonna place the palms of my hands on different parts of your back, and I'm gonna have you repeat the word 99, okay?
Okay.
If you don't mind just leaning forward for me. Okay. Go ahead, okay?
99. 99. 99. 99. 99.
Okay. So as I was at the top, I heard I felt the vibration more, and then as I moved down to the base of her lungs, I felt it kind of begin to fade away, which is a normal finding. Okay. And then now I'm gonna go ahead and do that on the front, okay?
Okay.
So if you could kind of just slide, swing a little bit forward so you're facing me. Okay. Go ahead.
99. 99. 99. 99. 99.
Okay, and same thing on the anterior side. I felt the vibrations more up here, and then they started to fade as I came down here. Okay, go ahead. Thank you so much. Okay, so now I'm gonna go ahead and take my stethoscope out, and I'm gonna have you lean forward, and I'm just gonna listen to your lung sounds. So each time that I place the stethoscope on your back, if you don't mind just taking in a nice, good breath for me, okay?
Okay.
go ahead. Okay, great. So those lung sounds were nice and symmetric. There was no like crackles or rails, no wheezing. It just sounded healthy. Okay?
Okay.
All right, and then now I'm gonna go ahead and do that on your front side. So if you don't mind, again, just kind of turning towards me. And then if you're comfortable, I'm just gonna do the same thing where I was kind of lifting up your shirt, okay?
Okay.
Go ahead and take a nice deep breath for me. Okay, great. And again on that side, your breath sounds were nice and strong and healthy. I didn't hear any wheezing, crackles, rails, nothing that would indicate that you are having difficulties breathing, okay?
Okay.
Great. Alright, so now I'm going to go ahead and move on to the vascular system and the cardiac assessment. Before we do that, do you have any concerns about your respiratory system?
No.
Okay, great. So now I'm going to go ahead and move on to the cardiac system if that's okay with you.
Okay.
Great, so I'm just going to ask you some questions the same way I did for respiratory, okay? Do you have any chest pain recently?
No.
Okay, and you kind of already mentioned that you don't have any shortness of breath. What about, do you have any difficulties with breathing when you're lying down?
No.
And this might be a weird question, but when you're sleeping at night, how many pillows do you use under your head?
One.
Okay, great. All right, and then you already mentioned no cough. What about like some abnormal fatigue?
Sometimes.
Okay, sure. Does that come on by anything in particular? Anything that you can pinpoint?
No, not really.
Okay. All right, and then have you noticed any swelling like all throughout the body?
No.
Okay. And do you have any past history or for your family of any cardiac disease?
No.
Okay. And then have you noticed any leg pain or cramping in the legs?
No.
Okay. And what about any lymph node enlargement?
No.
Okay. And are you on any medications?
Yeah, I'm taking fludrocortisone.
Okay, great. Do you know what the dosage for that is?
I think it was 0.1 milligrams.
Okay. And do you take that once a day, twice a day?
Once a day.
Okay, great. So, and is that for your dysautonomia in your chart?
Yes.
Okay, great. So, with dysautonomia, you have like rapid heart rate.
Yeah.
Yeah, and then maybe having some high blood pressure.
Mhm.
Okay. All right. And I've already asked you if you smoke, and you said no, so that's great. Okay. So I'm gonna start by just looking at your extremities, your arms and your legs, just to see if you have any swelling. Okay. So I'm just looking. There's no swelling. And then while I'm here, I'm gonna go ahead and just feel for temperature. So there's no swelling of the arms or the hands, and the skin on the arms is the same. It's normal for her ethnicity. It's that nice pale color. The skin is also warm and dry. Okay. Now I'm gonna go ahead and just look at your legs. I I'm not noticing any swelling of her legs or of her feet or her ankles. Again, I'm gonna feel for temperature. It's warm and dry, and the skin is the same pale color, which is normal for her ethnicity. Okay, and then now I'm gonna have you turn your head completely towards me, okay? Like, yeah, to the side, yes. Okay, and just relax, okay? Yep, great. All right, so now I'm gonna look at the side of your neck with my pen light for any palpations of the jugular vein, okay? Okay, and I'm not seeing any pulsations. All right, can you turn to the other side? Just gonna move your hair out of the way, okay? Again, not seeing any pulsations. Okay, so then now I'm gonna just feel your chest wall, okay?
Okay.
All right, her chest wall is nice and symmetric, and it expands equally on both sides. All right, I'm gonna have you lean forward. All right, and same with the posterior chest wall. It's nice and symmetric. Okay, go ahead and lean back for me. All right, now I'm gonna go ahead and feel for your carotid arteries, which are in the side of your neck. I'm gonna do one at a time, okay?
Okay.
Great. So yeah, if you could just tilt your head like that. Okay, beautiful. All right, so this right carotid artery, or I'm sorry, that's the left. This left carotid artery is nice and strong. I would say that it's a 2+. The rhythm is completely regular. Right now I'm gonna do this side. There we go. Okay, same on this side. It's regular, and I would say it's 2+. It's not bounding, but it's nice, strong, and healthy. Okay, great. And it's not weak and thready. The pace is consistent for each time that I hold it, and it's symmetric on both sides. Okay, and there's not any thrills, there's not any like abnormal vibrations, and I'm not seeing any like fast turbulent blood flow. Okay, now I'm gonna go ahead and feel your, these are your radial pulses. So I'm gonna just take both at one time if you don't mind. Okay. All right, these radial pulses are also symmetric. I'm feeling them both at the same time on my fingers. The rhythm is very regular, and they are both a 2+. They're not bounding, but they're nice and strong. It's not weak and thready. Okay, great. Now I'm just gonna remove your blanket, okay? Do you mind if I remove your socks?
Sure.
Okay, thank you so much. Just set them right there for you. And I'll help you put them back on at the end of our exam. Now I'm feeling for the dorsalis pedis pulses. Okay, those are nice and easy to find. Beautiful. All right, and again, these are also symmetric. I feel it at the same time with each of my fingers. The rhythm is normal, it's not weak and thready, and it's a nice 2+, so it's not bounding. Now, if for some reason I couldn't find her dorsalis pedis pulse on either of the feet, I would go ahead and get out a Doppler, just place some of the gel on the area, and then use the transducer to look for the pulse. All right, and I'll help you put these socks on when we're finished, okay?
Okay.
Great. You're doing great. How are you doing so far?
I feel fine.
Okay, great. All right, so then now I'm going to do the capillary refill. So I'm just gonna press down on your nail bed, okay?
Okay.
All right, so the capillary refill on her left pointer finger was 2 seconds. Now I'm gonna do the right pointer finger. And that was about 3 seconds. Okay, so sorry, now I'm gonna do your toes. I'm gonna do it on your big toe, okay? Okay, so on the left big toe, it was about 5 seconds. So since that's over 3 seconds, I would document that as an abnormal finding. Okay, and this one on the right big toe, it was about 6 seconds. And her feet are not cold, so that's how I know it's an abnormal finding. If her feet were excessively cold, then I would try warming them up before I take the capillary refill again. Okay, now I'm gonna have you come down so that you're laying flat, and I'm gonna have you flip over to your left side, okay, so you're facing me. Yeah, I'm gonna kind of have you like this. If you don't mind, I'm just gonna lift your shirt up. So I'm kind of going in the 5th intercostal space to feel for the point of maximal impulse. Okay, so that I'm feeling it right about the 5th intercostal space. It feels regular to me. There's no lifting or heaves. How are you doing in this position?
Fine.
Okay, great. All right, so I'm gonna have you stay like that for just a minute. So now I'm gonna go ahead and auscultate for the apical pulse. Okay, great. You can sit up now. All right, so I was listening for that apical pulse. It feels nice and strong. It's not weak, and there's no like abnormal rhythm. Okay, now I'm gonna go ahead and we're gonna go back to the carotid arteries. So I'm gonna go ahead and just listen with my stethoscope to them, okay?
Okay.
We're almost done. How are you doing?
I'm fine.
Okay. All right, so I'm gonna go ahead and listen with on 3 different places for the carotids. So I'm gonna start at the base. Okay, and after listening on the left side, I'm not hearing any bruise, which is turbulent blood flow. Okay. Okay, and same on that right side, there's no bruise. Okay, all right, so now I'm gonna go ahead, this is the last step. So I'm just gonna listen over your front chest for your heart sounds, okay?
Okay.
So there are a couple spots I need to hit, but as I'm going through, I might just kind of inch in a Z pattern, okay?
Okay.
Do you mind like shifting again? Okay. Great, thank you so much. Okay, so in the first intercostal space, I'm listening for or it's in the second intercostal space on the right sternal border. I'm listening for the aortic valve. Okay, that's nice and strong. Now I'm going to flip over to the second intercostal space on the left sternal border for the pulmonic valve. Again, her heart is, the heart sounds are nice and strong. I'm hearing S1 and S2, no S3 or S4 or any murmurs. All right, now I'm gonna move down for Erb's point, which is the third intercostal space on the left sternal border. Okay, again, nice and strong. So now I'm moving down again for the tricuspid, which is the left sternal border of the fourth intercostal space. Again, nice and strong. I'm only hearing S1 and S2. Alright, and then now I'm moving down to the fifth intercostal space for the mitral. Okay, I'm just gonna kind of, sorry. And this one's on the mid-clavicular line. Okay. And again, only hearing S1 and S2. The heart sounds nice and strong. Okay, great job, Elizabeth. How are you feeling after that exam?
I'm good.
Good, okay. I'm gonna help you get back into bed. Beautiful. Okay, great. Alright, so you did great with this. I'm gonna go ahead and just document these findings in your chart, okay?
Okay.
That'll take me about 15 minutes, and then once I'm done, I'll come back and check on you, okay?
Okay.
Alright, do you need anything before I go?
No, thank you.
Okay, so I'm gonna make sure the bed is in the lowest position, side rails up, and here's your call bell, Elizabeth, okay?
Thank you.
Alright, I'll see you in 15 minutes, okay?
Okay.
Thank you for letting me complete that assessment. Alright, completing hand hygiene, and then I'm leaving.